to carve out this budget is carving a part of yourself out, because we all love this county. And I want to acknowledge that this discussion is going to be a push-pull to arrive at the best conclusion possible. We don't typically do these type of deletions at mid-year. It's usually a very long, involved process, the annual budget process, through workshops and hearings where we're able to have information, seek information. Something that I do is that when I see proposed deleted codes, I contact the department heads. I contact my labor partners. I contact staff that I may have used to work with myself. There are some opportunities for that once in a while to understand what is the service impact, right? And I take this personally too. I was raised by this county. I received your Medi-Cal benefits. I received care at VMC. I stood in line at SSA with my parents. And then when we couldn't have a translator, we were sent home back on the bus to come back another day. That other day never came because my mom couldn't take time off of work and she couldn't pull me out of school anymore. These are the consequences that happen at the ground level. You all feel it, I know. And I'm sunshining this to the audience and to those who are watching, that this is a painful, painful process. And to have this done at mid-year did not give me the opportunity to understand the full service impacts. But let me just say this, of the phone calls and the consults I was able to make, the majority of what you're proposing today is really the best possible scenario for us. I can't say that for a small minority of, like a portion of this budget, because I don't have the answers. So Paul, one of my questions to you is that we heard from the Vietnamese American Service Center staff today, and having been at the VAS, we started a few years ago in 2021 with one charge nurse, and then over time a second charge nurse was added, and now we're hearing that one charge nurse removed. So basic questions. Number one is, the charge nurse that's slated for deletion, once that code is deleted, does she have a place to land? Will she go to another job, another clinical setting where she can continue working for the county providing care? That's my first. The second is, operationally, because we've gone from a one charge nurse multi-clinic model, integrated service model, which is unique to the VASC. We have dental, we have lab, we have ambulatory care, behavioral health, we have pediatricians, we multi-service. Can they survive and thrive and meet the client demands with one charge nurse who won't be able to have another nurse relieve them if they're the only ones? Or am I wrong? Is there a way for them to be relieved? This is really to understand.
To your first question, the answer is yes. The RN will have a place within our healthcare system to continue her invaluable work for our patients. And let me just kind of give some background before I answer your second question. This is where we as a healthcare system have asked every department and program to identify where there's opportunities to operate more efficiently, identify cost savings in order to get to that $200 million mark. That ask is throughout the system, every program, every clinic. And as we receive these proposals, we balance that with the needs of the entire healthcare system in terms of trying to maintain access. So to your second question, VASC is geographically very close to Tully Clinic. And so the management of both Tully and VASC is under one individual, the health center manager. And he is responsible to ensure that there's appropriate coverage at both clinics. And so there will be an opportunity for us to provide relief to that clinic, and not just relative to the RN, but also relative to the HSA, the HSR, excuse me, and or the LVN, because we have to maintain consistent coverage there. So we are going to have to work differently in order to achieve a situation where we are lowering our cost of care, but still delivering the same level of service. It is something that we are going to have to monitor. And one of the ironic situations that we're confronted with is that we fully expect going forward, as people lose coverage, they're going to become dependent on your healthcare system. So I think across the board, we're going to start to see volumes change and shift to your healthcare system. And we are going to have to make adjustments there. But it's going to vary by clinic, and it's going to vary by location, and we have to be flexible enough to adapt and to shift our resources. We started to see that between Regional Medical Center and O'Connor Hospital and Valley. We started to see the census of Regional Medical Center spike. Some days it reached 218, 220 in terms of a census. We started to see O'Connor census kind of level off, and in some units start to decline, such as in the ICU. We have to be, as a healthcare system, flexible to shift our resources to where they're most needed in order to maintain the level of service that we expect to provide to our community and maintain accessibility to those services. You're going to start to see that throughout the healthcare system. In primary care, not only were there positions that were filled deleted, but there were vacant positions deleted, where we believed that we can achieve some efficiencies across the board within primary care and specialties. And so we are going to monitor the volumes and the staffing needs by clinic and adjust accordingly.
Thank you, Paul. I want to make sure I repeat back to you that I received it correctly, since this is the first time we're having this conversation. It's the coverage is not going to be a concern at this time, but you will monitor the volume of patient care here. And when we say monitor, does that mean adjust accordingly to ensure that there is appropriate coverage for our patients?
Yes.
Okay. And then that this nurse does have another position. It sounds like a lateral move at another clinic.
Yes.
I'm going to use the remainder of my time just to say that it's not normal for this to be done at mid-year. James, I'm going to look at you. I'm not saying that you did this on purpose. This is just a really crappy situation that we're in through like a manufactured crisis through no fault of our own. That's why we're here. And I hope that for future cycles of mid-year that we don't have deletions discussed here, but at a more forgiving setting that allows us the time to dive in and have these conversations about things.
Yes, Supervisor, we actually learned a lot. It's been many years since our organization, it's not unprecedented. I actually remember the board having to pull $52 million out of the contingency reserve at mid-year in 2011 related to a failure by the city of San Jose to pay an amount owed by the county. So it's not unprecedented, but it's been a very long time. I don't think we've had something like these kinds of mid-year adjustments probably since around that time frame. We've learned a lot. As the board heard public comment, I think at the last meeting, about some concerns related to the timeline and process of notifying staff. We've learned a lot from that as well. Suffice to say, it's been very challenging for our departments and OBA and ESA as well. That is why we also forecasted many, many months ago that these health system impacts were coming. We did need to do something related to what was going on in SCVH now. And so we've had to take action to bring that forward here. We are fortunate that it's really two departments we're talking about with filled position impacts, the DTAC and SCVH. But we agree that it is easier managed for everyone through the budget process. Of course, we don't know what might happen over the course of the next few years, if the federal government does something, whatever else. But we agree with you on that bigger picture principle.
Yeah, we also know it's going to be worse next year, right? This budget picture right now is going to be for sure worse next year.
Absent something else surprising happening, that's our best information, unfortunately.